Can you be awake during an eyelid lift? The answer is yes. An upper eyelid blepharoplasty and or a lower eyelid blepharoplasty can be performed under local anesthesia only. It's a small enough area of your body that we can completely numb it up while you're wide awake and perform the procedure while you are wide awake. The main reason to go to sleep during eyelid surgery is so that you don't have to be awake or remember that you had the operation. So that would be the main reason to go to sleep. As far as pain goes, if you can tolerate having the area numbed up, the pain isn't very severe if you're awake during the treatment, meaning the only pain you feel during an upper or lower eyelid blepharoplasty while you're awake is the process of numbing you up. Generally, before the procedure, I will prescribe you a anxiolytic like Xanax and a pain medication to take before the procedure. However, you are still awake and talking during the operation. If you would like to be so sedated that you don't remember it and you can't talk, then we would need to have an anesthesia provider give you or administer IV sedation or general anesthesia, because I am not allowed and it is not safe for me to give you a high level of sedation and be your operative surgeon at the same time. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.